Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Remember, you can text us your questions to 336-379-5775. So, Dr. Swords, you know, within the last 30 minutes, the city of Greensboro announced that face coverings will be required in city limits starting at 5 o'clock tomorrow. So this means people are going to need to wear a mask of some sort in the grocery store, pharmacies, businesses, public transit. What do you think about this?
I think it's a great idea and completely support it. It is one thing we know that helps prevent the transmission of coronavirus, and everyone should wear a mask when they're out in public.
How important are those face masks, and how do they stop the spread of the virus?
It's a great question. Some of the answer to your question is we really don't know, and we know it's important. So we don't know the absolute percentage, but we do know that people who wear a mask are doing the most to protect others from the person who's wearing the mask. So if I wear a mask and have coronavirus, I'm doing more for you than I'm doing for me. And so if I cough or sneeze into a mask, it's unlikely that I'm going to transmit the virus. If you, in addition, are wearing a mask, it's unlikely that you will inhale any virus that may be in the air by being in the same room as I am. If we both wear a mask, the likelihood of us transmitting the disease between each other becomes really low, and it becomes almost zero if we're 6 feet away from each other.
So do you think that this requirement in Greensboro will help slow the spread of coronavirus within city limits?
It all has to do with whether we're adherent to that advice and mandate. And my recommendation is we should all wear a mask when we're out in public. And if we do that, it will have a dramatic effect on the transmission of the disease within Guilford County. What I think really ought to happen is that mandate should be spread far and wide so that all of us are wearing a mask all of the time, no matter what county we're in.
Yeah, so once again, that mandate is for the city of Greensboro, and it starts at 5 o'clock tomorrow. And Dr. Swords, you already started to mention it, but do you think the entire state should follow suit? Should the governor put in place some kind of mask mandate?
Yeah, so short answer is yes. And it should be broader than that. All of our boundaries are pretty artificial right now. The virus doesn't care whether we're in the city of Greensboro, the county of Guilford County, the state of North Carolina, Virginia, South Carolina. We all have to wear masks, and it's very easy to do. It takes almost no energy, and it just seems so obvious that it's hard to understand why someone wouldn't wear a mask. It's to protect others, and this is all part of a community effort and really part of common courtesy when it comes down to it.
We are already getting many questions about masks, Dr. Swords. One of them, what are the best types of masks to use, and what's going to protect me the most?
What will protect you the most is for other people to be wearing a mask, just like the way that you can protect others is for you to wear a mask. The best type of mask, that's one of the areas where we know less about. There are certainly medical masks that are the best. So we've heard about N95 masks. Those aren't commonly available. The data suggests that any sort of mouth and nose covering fabric, some sort of synthetic material, any of that is better than none of that. And we think any sort of nose and mouth covering works.
Someone asked, does the mask need to cover both my nose and my mouth the entire time I'm wearing it?
Yes. There's no reason to, you have to cover both your nose and your mouth or it doesn't work.
And another person asked, how often can you reuse a mask? Does that depend on the type of mask they're wearing?
It probably does. And so cloth masks, as long as they're washed and kept in reasonable condition, those can be used for a long time. These masks that you might buy at a pharmacy or a grocery store that are of synthetic material, those can get worn more quickly. I would, depending on how much you're wearing them and how much you're out, they might last up to a week. If you're wearing them all day long because your job or life requires you to do that, you might want to change that out every day or two.
And speaking of that personal protective equipment, PPE, we did get a question about gloves. Someone wanted to know, do they really matter when it comes to this virus, and can they help me not get it?
Gloves are another type of personal protective equipment, and they aren't as important as wearing a mask and having others wear a mask. The idea is you wear gloves, you're less likely to get it on your skin. If it's not on your skin, you can take the gloves off. So if you touch your face with gloves or your hands, that's a problem. You shouldn't do that. But the idea is you can at least take gloves off and then you can touch your face, and maybe that's better. I'd spend more time thinking about hand hygiene, washing your hands, using an alcohol-based gel for your hands, and concentrate on the mask.
So we're moving on to getting more testing questions. People wanting to know how often they should be tested. Someone even asking, should I be tested every 2 weeks for COVID-19?
This again gets into the realm of the things that we may not know yet. In a perfect world, we would test broadly and frequently, because if we could do that, we would isolate people who we knew had the virus. We could quarantine those people and have a really aggressive campaign about stomping out the coronavirus using testing and quarantining. We're not at that point. We don't have the availability of tests. And so given that we have some restrictions, I would still recommend that people who have symptoms go and get tested. There are plenty of ways to get tested these days. And perhaps more important than getting tested is stay away from each other until you can get tested and know the results of the test.
Dr. Swartz, we've been doing these Q&As for quite a few weeks now, and one of the questions we've gotten from the very beginning is, can you get the coronavirus more than once? Do we have any more insight to that?
Well, we don't have any more insight, and the reports that you might hear in the news, even in medical literature, are not well founded. We at this time still think when people are infected with the coronavirus and have a normal immune system, they will mount an immune response that resists them from getting coronavirus again. We think that's true. We have heard reports where people can shed the virus or the RNA that the virus contains for weeks and months. We don't know what that means. If people get sick while they're shedding that virus, we don't really know if it's related to coronavirus or not.